Part 2 of Safety and Infection Control. Welcome back. I am Nurse Amara. We left off with a scenario in Safety and Infection Control. Let's look at the answer and rationale. The correct answer is 4. Ensure the client performs hand hygiene with soap and water before leaving the room. The rationale. The why. In Safety and Infection Control, the RN must understand the specific ingredients required to kill certain germs. C. diff is a spore-forming bacteria, which makes it much tougher than a standard virus. Why #4 is the priority? C. diff spores are resistant to alcohol-based hand sanitizers. The only way to physically remove the spores from the skin is through the mechanical friction of soap and water. By having the client wash their hands before they touch the wheelchair or hallway surfaces, you are stopping the germ at the source. Why not #1 or #2? C. diff is spread through the fecal-oral route, contact, not through the air. N95 masks or surgical masks are unnecessary and do not address how C. diff actually spreads. Why not #3? We don't put PPE on the patient. PPE is for the staff to prevent them from carrying the germ from one room to another. Putting a gown and gloves on a patient can actually be a safety hazard, tripping or heat, and doesn't stop the spread as effectively as hand washing. Nurse Amara's Safety Checklist. Nurse Amara, when you are answering safety questions, always look for the least restrictive and most effective action. Here is my final tip for your safety ingredients. C. diff rule. Bleach wipes for the equipment, plus soap and water for the hands. TB rule. N95 mask for the nurse, plus surgical mask for the patient, if they must leave the room. Restraint rule. Never tie a restraint to a side rail. Always use the bed frame. That brings us to the end of our Safety and Infection Control Masterclass. You've done an incredible job tonight. We've covered everything from the cloudy to clear insulin rules to EKG lifesavers, and now the golden rules of keeping your unit germ-free. Remember, a safe nurse is a nurse who assesses first and cleans often. You are building the muscle memory you need to pass this exam and, more importantly, to keep your future patients safe. Keep up the hard work, stay consistent with your practice, and I'll see you in our next session. Goodbye for now, and happy studying!